Hi, my name is Dr. Marc Braunstein. I'm Assistant Professor of Medicine at the NYU Perlmutter Cancer Center, NYU Langone School of Medicine in New York. And I'd like to talk about the role of palliative care, sometimes called supportive oncology, in multiple myeloma, as well as review some of the data we presented and others presented at this year's 2020 ASH meeting. So overall survival for multiple myeloma is improving due to the development of novel agents and therapeutic approaches for this incurable disease. And as a result, patients may be living longer, but they may be living with a higher symptom burden, either due to complications of the disease or its treatment. So palliative care or supportive oncology is a branch of medicine that deals with co-managing patients, especially patients with malignancy, to provide relief from symptoms, from the stress of illness, and with the goal of improving quality of life for both the patient and their caregivers, regardless of the prognosis. Sometimes palliative care can be mistaken for end-of-life care, but we now appreciate that co-managing patients along with a palliative care service can actually improve outcomes and even overall survival. Multiple myeloma can behave like a chronic disease at times, so patients may not be offered palliative care services because the prognosis might not be unclear, or it might be better at certain points of the disease and maybe more, the patients may have a higher symptom burden at other points in the disease. So the data we presented at this year's ASH looked at retrospectively at patients with hematologic malignancies, including patients with multiple myeloma, who were admitted in an inpatient setting and did or did not receive palliative care consultation. Among the 370 patients with hematologic malignancies, 74 of those had multiple myeloma. And what we found is that only about 1/5 of patients with multiple myeloma received a palliative care consultation while admitted. If they did receive a consultation, this was associated with reduced 30-day readmission rates and higher intensive care unit admission rates during that admission as well, which means that they may have been sicker, and that's what prompted the palliative care consultation. However, the majority of patients did not receive that consultation, and if they did receive the consultation, it was associated with lower readmission rates. Other studies that were presented at ASH, for example, a abstract by Dr. Pamela Egan from Brown University, compared end-of-life quality of care outcomes and indicators of palliative care needs in patients with solid and liquid hematologic malignancies. And they found that patients with blood cancer, such as multiple myeloma, were less likely to be offered palliative care services and had shorter length of stay in hospice due to more advanced illness. The other abstract I want to mention is one by Dr. Saqib Abbasi from Kansas University, who looked at hospitalization at the end of life of myeloma patients using a national database of hospitalizations in the US. And they found that about 48% of all deaths related to the myeloma occur in the hospital, despite a general decrease in the number of inpatient deaths over time for the general population. And this may reflect a decreased likelihood of patients with multiple myeloma having access to palliative care services earlier on in their disease course. And so I think these data as a whole give us the impetus to consider palliative care earlier on for patients with multiple myeloma.